Hi, I'm Mike Hatton, and for over 20 years, I've been in a management role that saw me working with other managers from entry level up to and including the C-suite. The experience gained have positioned me to help many other leaders manage the stresses of not having enough time at work, not having enough family time, neglecting their health, and many other challenges magnified by the recent pandemic. I founded Human Cornerstone Facilitations LLC in 2008. It was based on the need to help managers improve their productivity and that of their team. I would like to show you the roadmap to becoming a great leader by harnessing your team's strengths. Welcome to my show, Cornerstone, where the foundations of leadership begin. Hi, ladies and gentlemen. My name is Mike Hatton. My show is called Cornerstone, and I want to thank you for watching. I have a guest today who's the co-founder of a company called Advantage Healthcare Systems. He's shown incredible leadership abilities and an incredible business acumen. And I'd like you to welcome to the show, John Zacharias. John, welcome to the show.
Thank you, Mike. Thank you for having me here.
You're very welcome. Let's just jump right in. I always like to ask people what inspired them to start a business, a successful business. Maybe a mentor or just some transformational moment you can think of.
That's actually quite easy, Mike. So when I was growing up, since I was 9, my mom and her husband at the time actually started a practice. So he was the doctor and she ran the office, and it was actually in a house. The basement, this was up in Holly, Michigan. So the basement was a business office. The ground floor was the clinic. The upstairs was where we lived. So here I was, a little 9-year-old running around all over the place and doing all that. So I grew up in that environment and absolutely loved it. You know, she is still quite a woman. She moved us down here in Texas from Flint back in '89, as fast as we could. And sat there, and I finally graduated high school here, and thought I wanted to be a chiropractor, so I went and did all my prereqs. And school wasn't something that I enjoyed much. So when I went to college, I would take like 29, 30 hours a semester, because I figured if they can do it, why can't I? And 2.5 years later, burnt myself out, and I was all done with my prereqs, ready to start, but decided to take a summer off. Well, Mike, that lasted 5 years.
The long summer.
I got married, had my daughter, and ended up missing her actually crawl for the first time. So it brought back memories of me growing up in a clinic, and called my mom and said, listen, you want to partner up? And so I flew back down to Texas. We partnered up and then started growing what we have today.
You know, that's an incredible story, and it really reinforces something that I tell clients that I work with about leadership. I always ask people the question that I just asked you, but I've always told clients that almost everyone learns the basic principles of leadership bouncing on a parent's knee or a grandparent's knee. That's where it starts. Now, you have other mentors along the way, but it sounds like your journey was not much different.
Nope, it was right there.
That's fantastic. Well, as I said, Advantage Healthcare Systems. Why don't you tell us where you're located? You've got quite a sizable organization, and you've got some incredible growth plans that we'll talk about a little later in the show. But where are you located?
So we are based out of Dallas, but we have facilities all over Texas and also in Louisiana right now. A little bit about our Advantage is it's focuses on traumatic injuries. Really focusing towards traumatic brain injury, concussions, back injuries, occupational injuries. So we get some cases that are really a pleasure to treat and get better, because you get to see the results that are amazing. But they are more difficult than what normally you would actually have. So our practices did start in Canton down here in Texas, which is about an hour east of Dallas, where famous First Monday Trades Day is. But then, of course, we migrated up here and then just gone all over.
Okay. I think the right term might be if I said that your clinics are multidisciplinary. Mm-hmm. Is that correct way to
multidisciplinary.
Multidisciplinary. Okay, we'll say it that way. Why don't you explain what the different disciplines are that you see? That's one of the things I think that makes you unique.
It's, we've always liked a Health South model because they were more focused on the physical medicine side of it and the mental side of it. So as we grew our practices, we have chiropractors, we've got medical providers, we have physiatrists, which are specialists in physical medicine rehab. We have neurologists, we have psychiatrists, pain interventional docs. We also have our OTs, occupational therapists and physical therapists, speech therapists, social workers, and then case managers and vocational counselors. So when somebody comes in, they get the full benefit of being treated from every aspect that you could imagine, from even addiction to people with cognitive deficits to people who have, knee injuries to spinal injuries. They're going to get every aspect that you can imagine focused on them at one specific time.
I see. So I'm curious, when you started, when you co-founded this, when you called your mother that day, did you have the vision for all of these disciplines at that time, or did you start with one and then kind of grow outward from that based on a need?
So we knew where we wanted to go. When I partnered with my mom, we knew that we wanted to add the different disciplines, but the issue is that there wasn't really standard of care out there for everybody. So trying to get it to where it made sense and it was financially feasible, we had to add a piece at a time. Ultimately, the brain injury side is the most recent division that we added, and that was about 7 years ago. And that really is a next level. But we knew a handful of what we wanted, but then as we grew it, just little pieces started coming and fitting together like a puzzle. And we've been fortunate enough that it's worked that model and it's actually panned out. Right now we are trying to expand our model over the entire U.S. into 300 to 400 clinics. But it's really about trying to make sure that the model fits in other practices that are out there. So same way we did.
So I like the way that 300 to 400 clinics just rolled off your tongue there. You have an incredible vision there, and you said that so easily that it's obvious that you believe that's going to happen. You have, I think you told me 11 clinics now?
Yeah.
How many employees?
We have about 130 employees and contractors. And it's, to get to 300 to 400 clinics, we're going to be partnering with other providers to do that. But I'll tell you, Mike, the reason why we're doing it is, the TBI, or traumatic brain injury side, is a personal aspect to us. Both my brothers had a TBI. My older brother, literally was in a coma for 2 days. My younger brother was in a coma for 6 hours, and they both had aspects of it. And there wasn't a lot of knowledge back then whenever they got it, as far as medical journals and studies and things like that. So as years progressed, we started learning a little bit more about that. And so when it really came public out there was when the movie Concussion came out. That was, it was a movie about the NFL players. Mm-hmm. And if anybody hasn't seen it, I would suggest definitely see it. But the thing that we're trying to do is make it standard of care of treating people with concussions, so that they don't have to have the long-term effects that people would normally have. And the only way that we've been able to come up with a strategy on that, and literally it just came up last year that we decided to do this, is if we can get 400 clinics nationwide, we can get it standard of care. We can get insurance companies, we can get everybody to sit there and actually accept it. And that's truthfully, the vision right now is how do you get it so that no one's left behind? No injured people are left behind. No vets are left behind. I mean, it's crazy.
That's incredible. That's a very worthy goal. With the amount of employees you have right now, and you're a family-operated business, by the way. You have a leadership team that's family. I'm sure that I know from working with the clients that I work with, I know it's a leadership challenge to manage 130 employees. Is there anything about your leadership philosophy that you'd want to share, or?
Honestly, it's about having just good people around you. You know, it's everybody we've got about 30 family members that are within our organization too, but it's not just them. We have, most of our people have been with us over 10 years, 10, 15 years. They love their space. They know their space. They work well with the people around them. And I would say even at expanding past that, making sure that you just either partner or work with people that can see the same vision that you actually have. If they don't see your vision, then it's not even worth even working with them. So that's the advice that I would probably have to say.
You just hit on something that I talk to almost every client that I have about when I work with someone about leadership or training. It's the training. It's how when you get that person in, when you intake a new employee, how you train them, how you get them to be able to relate in a few words to the new customer that comes in, what your company is about, your why. And if you can do that, you can not just have happy customers when they leave, but you can have happy, loyal customers when they leave so they keep coming back. Do you agree with that, or do you have a different philosophy than that? Or
no, I think I completely agree with that. I think it's a little bit different because in our facilities, people might just come in and get adjusted. They might just come in to get occupational therapy. They might just come in and get PTs. So I would say it's division oriented in that aspect. But as long as they have, with our new people that come in, we try assigning them to a mentor within that division. And then that mentor is going to sit there and actually teach them the goal of what they do and what that division does. Now, as a as a whole company-wide, they know what we're wanting to do, but they're normally specific to their own division. I hope that made sense.
No, that makes perfect sense, especially the part about the mentor. Mentors are so important. I wouldn't be where I was if it wasn't for a mentor that asked me where I saw myself in 5 years when I was about 21, and I had no idea. At 21, I'd never thought of that, you know. And he'd smile and had me come back in 2 weeks and explain to him then, and that started me on my entire journey. So, and the fact that you have 10 to 15-year employees certainly says that you're doing something right along the way there.
Or they are, one or the other.
Yeah, of course. Well, you're a very humble man, and you give credit to your employees. I can see that right now. So, as you take this from 11 to 300 to 400 clinics, do you have a specific business plan in mind already, or are you still developing it? Are you going to go with regions of the country, or how are you going to do that?
We probably have 80% of it designed out already.
And I don't want you to give away any trade secrets so that someone will, you know.
But there's specific states that will be easier to work in. You know, in medical, you have things called corporate practice of medicine, which are restrictions of allowing non-physicians to actually practice in that state or own the companies within that state. So, and then there's ones that have addressed brain injury, which is only one, is Washington. And then there's others that haven't and don't even have any guidelines whatsoever. So we've picked out states that would be easier to work with insurance companies, to work with the laws and the states within there. We're going to focus on that first. We also want to work with Department of Defense and the vets and Tri-West and Tri-Care because they have their stuff down, but more on an inpatient level. And plus their backlog is so huge, it's crazy. So if we're able to push this out into communities to be able to serve everybody within that realm, it will probably start off with 29 states as our first pick. And then after that, hopefully we can get additional national contracts so that we can expand into the states that really are going to be very strict.
I notice a lot of the newsletters and a lot of the articles that I follow that it appears to me that the VA is starting to get more engaged and start to look at different disciplines of care and maybe a little easier to work with. Would that be an accurate statement in your judgment, or?
Without a doubt.
I'm not trying to get you to criticize the VA or anything, but.
Well, I mean, they're serving one of the largest populations in the world of people that are injured. So it doesn't matter who they are, everybody's going to sit there and be backlogged on it. But the VA has gotten a ton better in the past 5 years. When they signed the bill to allow outpatient centers to be able to see people, it helps sped the whole process up. Plus, traveling to the VA sometimes is inconvenient when you can be treated a half a mile down the road. But yeah, the VA is really doing a good job in our opinion. We just think that they need to be able to utilize the world's resources to treat our people, not just theirs.
I drove, it's interesting you say that. I drove up through Alabama not very long ago, and I was in a very small town in Alabama, not unlike where I grew up in West Virginia, and I noticed just a very small building that was a VA health clinic, and I'd never seen that before. So I think that's a really good thing.
Yes, absolutely.
Okay, great. So as you talked about traumatic brain injury and things like that, you've actually expanded your knowledge base, and I know you have some friends and doctors that you work with around the company. Do you see this as more of a challenge post-COVID, and what do you see some of the challenges to be post-COVID? Is getting care for traumatic brain injury and things like that?
It depends on the spikes. Everyone's saying that we're going to get hit with another round of COVID in the next 30, 45 days. Let's hope it's not as severe as the rest of them, obviously, and it just comes and goes real quick, like the last one did. But I would say that our challenges are not necessarily due to COVID. Actually, COVID has helped us, not from the disease level, but has helped us with breaking down barriers, utilizing telehealth, which is huge now. We as a company learned how to even do rehab at people's homes via telehealth, how to set them up properly, what equipment they needed. It helped push some of our providers who would never consider telehealth into having to do it, because when we were at the peak of the pandemic, if they didn't treat them at home, the people never got the care. So you look at them and you're like, well, are you going to see nobody today, or are you going to log online and help some people? And some of it's just, I'd say, a routine that we all get used to. How we tie our shoes and how we put our pants on and all that sort of stuff. But then if you can't do it, that routine, well, then you change. So I think COVID has helped us enormously. Even some of the state laws, before it prohibited telehealth for physical therapy, for other things, occupational therapy. But, the people don't need to necessarily travel a lot if they can do some of the stuff at their house. And so I think this is going to help. I think it's going to help a ton of people. And I'm excited to see it as it progresses, especially when they just eliminate all the restrictions and off we go.
This is anecdotal, but to your point, I would agree with that. Telehealth during COVID, I had occasion to call them. I'd never called them before. I never thought I'd ever use that. I had a sore throat. I just couldn't get rid of the sore throat. I didn't have a fever or anything like that. I tested negative for COVID, so I called up telehealth, and the doctor, I was really impressed. He was very thorough. He walked me through, asking me enough questions. When he decided I didn't have COVID, then he prescribed something for me, and I thought, what a great way to do this. Over in the comfort of my own home over video, instead of going into the office with my sore throat, with 20 other people with their sore throat, and maybe some of them with COVID, and everybody spreading this around. So I think it has forced a good change in a lot of ways, like you say.
It has. I think that if it did not happen, it would have been another 25 years before we would have gotten there. I can remember the first telemedicine conference I went to was out in Las Vegas, and this was back in 2001. And I have been trying to get us to do telemedicine since then. Back then, it was only really the military doing it, which you can see because people are being deployed and they don't have anybody that speaks English in some of the places, so they needed to do it. But the technology also wasn't really there back then either. I can remember getting dial-up when I was 1997. So, 4 years later, that page still wasn't loading very fast,
It was
You had to have a telephone line to hook
10
in.
minutes to sign in.
You know, so it was one of those scenarios that, when COVID hit, the internet was there, bandwidth was there, the other ones, Zoom and all them, had just started streamlining their stuff. And so we were able to deploy it pretty rapidly, I think that if internet wasn't on the phones and on the iPads, stuff like that, it would have been difficult. But yeah, the first time I think we ever used telehealth personally is we're up in New York and my wife got sick and, she didn't want to go down there. I didn't want to go down to the ER and spend a couple $1,000s, right? So I was like, listen, let's just call a friend of ours and sit there and get him calling a prescription if he can tell you what it is. So we used the video chat. And I would probably say this was like in 2016. So it just started happening. So we used FaceTime is what it was, I think. Called him. He's sitting there looking in her throat, this and that. And then he's like, okay, yeah, I know what it is. And called in a script right across the street, went and got it. She felt great the next day and it didn't ruin our vacation. So this is what I think we all can do as we move forward. Even with the brain injury, there's a thing called neurofeedback. And so what you do is you end up hooking up these leads, which is normally like a cap you put on, and it hooks up to the computer and we can monitor people while they are utilizing this therapy. But that's all done over the internet. So there's so much that we can do to help now because of COVID. It's amazing.
So that brings me to think of HIPAA concerns. And I forgot exactly what the acronym means, but basically HIPAA is your responsibility to protect the privacy of my medical records if I'm in your office. And I know there's concern about the transmission of those records over email and things like that. As a matter of fact, I read an article the other day that the primary secure method still considered to be the gold standard is the fax machine.
It makes no sense to me.
I know, but I read it on the internet. It must be true. But no. So have they solved that with telehealth? Are you confident that that's all solved and everything? How can the person watching this show be assured that their privacy is protected?
Well, in our space, especially during COVID, there was a lot of refining that was done to the rules and laws and regs. And there's certain encryption that has to be done now, even from a video aspect, even from only thing really not encrypted is a telephone call, right? So most people have gone to portals. So instead of emailing or even faxing, that goes to emails now, instead of emailing stuff out, you just send them a link and then they go to a portal and then they log in and they can download their own stuff and off you're going. But I think that for the most part, most people have, except for those clinics where all you see is those big paper charts, I think that the rest of the world has turned over to an electronic system where the encryption level is huge. I mean, you're talking double what HIPAA is requiring. And it's 510 encryption, I think is what it was. Well, it might be a little off. 512K encryption, which is gigantic. Before it's only 256K encryption. So it's huge. And that hasn't been cracked yet. So do I think it's good? I think we're good. I think we are.
I use a clinic that has portals. And I know when I was a new patient there, I uploaded every record that I had before I ever went in. And when I got there, the doctor had reviewed it. I mean, he'd done a thorough review of it all. And I found it, I was a little at first, well, I've never done this before. I don't know, is this safe? And after I did it, I thought, this is the way to go.
Yeah.
I really, really like it. So from that standpoint, things have progressed dramatically.
Yeah, they even have, they have a couple of systems now that are actually bridging between all certified systems that will be one repository. So you had to upload your charts. Within probably next 2 to 4 years, you're gonna get it to where if you make an appointment and you give us authorization just through a link or a portal, we can hit a button and it goes to every electronic system out there and pulls your medical records in for us. So it's gonna be a lot easier in the future. a heck of a lot either.
That sounds incredible.
Also scary too.
Well,
Just
I was
kidding.
thinking that. I wasn't going to say that, but since you brought it up, it was. But also uploading my charts was a little scary the first time I did it. So I'm sure that it's something that we'll all be able to get used to. Wow. So let's switch gears a little bit. Let's talk about John Zacharias. What do you like to do? What are your hobbies? What do you enjoy doing? What's your passion when you're not building a large business?
Honestly, I've got 4 kids. For a 25-year-old daughter, I have a 20-year-old son, a 17-year-old boy, and a 16-year-old daughter. Those are probably my hobbies, is what I'd call right now. So my 25-year-old daughter, she actually does EEGs, so they're brain studies on our traumatic brain injury people. But she went to school, got certified, does that, and flies all over the U.S. doing it. My 21-year-old son is just now going back to OU. Super proud of both of them. My 17-year-old boy, he's just coming into her senior year and doing very well, playing football. Yeah, with concussions, seriously.
Well,
I did make a pact with him that and he agreed to it, if he ever gets a concussion, he's done. And so he hasn't, he's still going. And then my 16-year-old daughter, she's just about ready to be a junior. But those are my hobbies. I'm a never-ending pilot student. I've been trying to get my license for 15 years, I want to say. Hopefully this year I'll complete it and be done. And then besides that, honestly, it's just family right now. I think eventually it'll be more traveling than anything, but why they're going to school and why we're trying to do this vision, this is where I'm at.
okay. You said traveling. They've just ended the negative COVID test requirement coming back in the
Yes!
U.S. I take it you think that that's a good thing? That's a safe thing for the people that might be watching and have that question?
I definitely think it's a safe thing. With the variants recently and everything else, the risk levels are not that high. Plus, if any of you have traveled overseas and actually got tested, you probably found that sometimes you can get tested and not tested and get the same result. So I don't necessarily think that thing is actually going to prevent anybody from getting over here. So get back. So,
Right.
I don't know. The first time I went to Mexico, they're like, do you really want to test or do you just want the report? I'm like, what? Seriously? And they're like, same price. Oh my God. So no, I think it's wonderful. I think that, I have friends in Australia, and other parts of the world that, they haven't been able to travel forever, and normally they travel every quarter.
Right.
But they could not afford to go in quarantine for 2 weeks coming back and everything else. So I think it's time for the world to open more back up. I really do.
Well, there's so much pent-up demand that travel has just exploded in the U.S. for a while. We'll see how long that lasts.
Yeah.
Well, we're about out of time, but as we wind down here, this is where I like to give every guest the opportunity to look into a camera, and what your camera is right there. John, if you'd like to look into that camera, take as much time as you want, 30 seconds, a minute, 2 minutes, and tell us what you would really like people to know, how you can help them, and how they can contact you, just anything you want. And we'll put the links up that you give us, and it's your time, and there's your camera.
Thank you, Mike. So we try putting out a couple of blogs every single week on traumatic brain injuries and the causes and the treatments and how to recover. So you could sign up on our Facebook and Instagram, and our website is advantagehcs.com. And it's got a lot of content there that can help you if you've got questions, if you have family or friends that actually have had concussions, or if they possibly have the symptoms of those. There's also a contact page there, and there's a phone number that reaches out to our wonderful people that we have that can help get you scheduled, or at least get you the resources. If you are in locations that we have, we normally can find people that can help you out with that anyways. So don't feel bad about just reaching out, even if you're in West Virginia. We can normally help you guys out. But thank you very much, Mike, for having me. I've had a blast, and this has been fun.
This has been fun. It's been informative for me also. I learned something every guest I have, but I've especially learned a lot today. So ladies and gentlemen, as we come to a close again, I'd like to thank you for watching the show. It's been something I hope you got something out of, and I hope to see you again on the next episode. Thank you. I want to thank you for listening today. I hope you enjoyed the show and found something of value to help with the challenges you face as a leader. Please feel free to share this show with your friends on social media, and don't forget to visit my website, thegrowthfacilitator.com. And while you're there, book a free call with me. We'll see you next time on Cornerstone.